narcolepsy is a fairly rare disease of sleep, and it is genetically determined, as far as we know, and it involves a wide variety of symptoms. It's often overlooked. I saw 2 or 3 people in the recent year, last year or so, they'd had it all their life, in their 40s, nobody ever diagnosed it. It's not that they went into somebody and said, listen, I've got something wrong with me, but when they were seen as patients, it was never identified. And it's a complex disorder. It probably has an immune origin. And if you have narcolepsy, there's a constellation of symptoms. People tend to sleep too much. They're hypersomnic, and they can have sleep attacks during the day. If you're sitting there talking to him, he'll be asleep until you wake him up. There's another symptom called Cataplexy. It's not about cats, but these people their arm will just go limp for no reason. That's called cataplexy. Or their head may go limp. Or they may actually fall to the ground with no reason, apparently. And sometimes laughter, things like that, emotionality will trigger cataleptic effects. Another important symptom is hallucinations that occur when you're trying to go to sleep. So they occur between the twilight of being awake and being asleep. So like being awake is stage 1, being headed to sleep is stage 2, and they get stuck in the middle. And they get hypnagogic hallucinations, and they can get real vivid hallucinations. I remember one patient told me that she saw Grandma come out of her closet very vividly, sit on the bed, but Grandma had been dead for 10 years. That was the only problem. It looked just like Grandma. So they don't hear sounds, but they can see really bizarre or unusual hallucinations. And they can also get a pretty high frequency of what's called sleep paralysis. It's when you're going through that same twilight period, you become paralyzed. You cannot move, you cannot utter any sounds, and it's pretty terrifying to people when that first happens. So they can't move, and it may last for a while. And if they go on to sleep, it'll go away. So that's called sleep paralysis. That can be a normal phenomenon, but it shouldn't be a very common one. But there are people that have that, and it doesn't really mean too much. So you've got to do a pretty complete history, detailed history, to figure out what you're dealing with. Because if somebody has sleep paralysis, but nothing else, they don't have narcolepsy, and they probably don't have a sleep disorder. So, and it's a complex disorder. And I usually, most of the time, but not always, I send those people to a sleep specialist. But I have treated a number of people successfully. And the drugs that are used are specific medications, and they do very well. But I've seen people in their 40s who've had it since teen years. It often starts in their teens. As does idiopathic hypersomnolence, which I mentioned a minute ago. It usually starts in the person's teens. The teenagers, sleep 15 hours a day. They just think it's being a teenager. Well, some of those people have a sleep disorder.